Hey guys.
Hey guys. Hey, this is Dr. Savage, and this is Suzanne
Suzanne.
Mullis. She's one of our physician assistants here at Bayside Orthopaedics. Thank you guys so much for tuning in. I know we've had a couple of little glitches there. I think some of you guys are going to have to join back in, and I'll wait to see some people join. We're trying to do some screen sharing so we can share some different kind of diagrams and things with you that we think would be helpful. But
We also forgot to introduce George.
maybe have a little trouble doing that. Yeah, that's right. So we
Mr. George Bones, our skeleton here at Bayside.
so we have George here. Yeah, I think we're gonna it's probably gonna be a little tough to share some things that we want to be able to show you guys, but that's okay. We got some good stuff to talk to you about.
Yeah, plenty of props.
We got plenty of props, and we got plenty of things to talk about here. So, hey, thank you guys so much who have sent in some questions so far. We've been able to see those, and uh, hopefully we'll be able to answer a lot of those questions for you guys today. And if you have any more questions while we're live here, we certainly want to try to answer as much as we can. So I think we got people joining back in. Sorry, that was my fault. I think I kind of messed that up. I think I was trying to do something technical that I don't think I can do. So, all right.
Everybody has their strengths.
Strengths and weaknesses. That might be one of mine. All right. Hey, so any of you kids out there who are joining in, hope we can teach you something about the skeleton and about bones today. Hope you guys hope you guys are just kind of trying to have fun with some learning that's a little different than what you might normally do when you're at school. So okay, we got a bunch of people joining now, so we'll go and kind of get started on our deal here. Okay, hey, so like I said, for you guys who are just joining, so I'm Dr. Savage. I'm one of the orthopedic surgeons at Bayside Orthopaedics. This is Suzanne, who's one of our physician's assistants. So first of all, I just want to tell you guys like what an orthopedic surgeon is and what a bone doctor does, right? So the real name for a bone doctor, or I guess the official name for a bone doctor, is an orthopedist. So orthopedic surgeon. And so we're doctors. We went to medical school, and then we just specifically decided to go into a field of medicine where we treat problems with the bones and joints and muscles. And we treat things for people of all ages. We treat kids. We treat people who are teenagers playing sports. We treat older people when they get problems with their bones, and it's really fun. For you guys who are kids, the really fun thing about treating you guys is you guys heal. If you guys get hurt, if you have a bone problem, you guys tend to get better, and that's a good thing for you guys and a good thing for us too. So I love being a bone doctor. I couldn't imagine doing anything else, and I really like. I like the science of bones and things, and I want to try to just help you guys learn some things about them today that maybe you don't know, maybe you do know, maybe you can ask us some questions that even kind of stump us a little bit. So we're a little worried about that. Right?
Go easy on us, sir.
Yeah. So I'm gonna let Suzanne tell you kind of what she does as part of our team, because I'm one of the doctors, one of the surgeons here, but it takes a whole team of people to treat people with bone and joint problems. And so, Suze, what do you do?
So my name's Suzanne. I'm a PA here at Bayside. PA stands for physician assistant. Some of y'all may have seen a PA. Some of y'all may not have realized you were seeing a PA until you got there and we introduced ourselves. But we are in all kinds of medicine, all different fields. And orthopedic specifically, it's special because like Dr. Savage was saying, we see all kinds of orthopedic problems, injuries, we see at different locations. So sometimes you come to us here in the doctor's office, sometimes we go to you in the hospital. But Dr. Savage is only one person. He can't be everywhere at the same time. So that's where someone like myself or one of my counterparts becomes an important part of that team. So we're usually not in the same place at the same time unless we're in surgery together, which is one of the perks of being a PA is we do get to go in and help out with a lot of the big surgeries. But we can see patients, we diagnose, we treat. So if he's seeing patients in the office, you may see myself in the hospital, whether it's in the ER or up on the floor. If you spend the night in the hospital, you're typically going to see one of us every day. So, but it's a very valuable part of the team because that's what it takes in medicine now.
Yeah, and Suzanne's the best. She won't tell you that, but she is.
Thanks.
So, and then another cool thing I'll tell you. Suzanne and I've been friends for a long time. So you do something like this, who knows? You might get to grow up and work with one of your good friends.
Pretty awesome.
And that's pretty fun too. So that's just a little bit about us and what we do. Like I said, would love to hear some questions from you guys during this, but we're going to start out just kind of telling you some basics about bones, why we have bones, what bones do for us. I will tell you, I had some pictures and videos, and technologically, I don't think I'm going to be able to get that to work. But we have some props. We have George here, our skeleton, with us, and in just a little bit, we're going to teach you kind of about every bone in the body, going through them on George. But Suzanne, what do we want to tell them about bones?
So, why do we have bones? Bones, every the simple answer everybody knows is it supports us. It allows us to move, whether we're running, jumping, waving, playing volleyball, whatever. It allows us to move. It gives us support, but it also protects us. We have our skull, which y'all know what the skull protects. The brain. Skull protects the brain.
That's an important one.
Yeah. Another important one are your heart and lungs, which are in your chest, and those are supported and protected by your rib cage, which on George here goes all the way around, and we'll show that a little bit later on. But you have your rib cage that protects your heart and lungs and liver, which are pretty important.
So that's cool. So two things bones do so far. So number one and number two are they help us to move, to get around. They give our body shape. That's the reason that we can move our arms, that we can jump and run. And then they protect our organs, like we're talking about. And then the third thing that you might not know that they do is our bones actually they make blood cells for us in a part of the bone called the bone marrow. So I think sometimes when you think about bones, let's grab a model real quick. I think you think about bones as being just really hard, right? And you see models of bones and well, let's see this one right here. That's good. So you see like a model of a bone, and this is like an ankle bone. So, well, it's part of it. There's more of a leg that goes up here, but this model is good. So you think of the bone as being really hard. So the outside of the bone is really hard and tough.
It's also called cortical bone.
Right, that's the cortical bone. Yeah, Suzanne's going to help me with my vocabulary here, which is good. It's a team. So cortical bone is the hard outer part of the bone, but on the inside of the bone, there's bone marrow. That's we call it trabecular bone, and different bones have different type of marrow cavities. So if I show you the outside of the bone, that nice hard white cortical bone, but if you can see, if I turn this way, and I think you guys can see this, kind of that red part on this model on the inside of the bone is where the bone marrow is. And so bone marrow is where different types of blood cells are made actually in the bone, and there's different types of bone marrow that our bones have. There's red marrow. And the red bone marrow is where the blood cells are made. Different types of white blood cells, different types of cells that work in your immune system and things, and different types are made based on what your body needs at different times. Now, there's also yellow bone marrow, which is more kind of just fatty bone marrow. So typically where your body makes the red blood cells in the bone marrow is in what we call the flat bones. So bones like on George here, like the sternum, which is like the bone kind of in the middle of your chest, or the pelvic bones, the ilium, and I put my hand right in front of it. It's hard to see, but that's where a lot of bone marrow is made in that bone. So that's where a lot of red marrow is. And then sometimes in the long bones, like long bones would be like the femur here. There's a different kind of marrow called yellow marrow that's mostly a fatty tissue. But the really cool thing about your body with bone marrow is if your body needs to make more of a certain type of cell, it can actually change some of the fatty marrow into red marrow, and it can adjust based on what your body needs, which is awesome. That it has the ability to do that. It's a cool design, and I think we're going to tell you a couple things today about bones where you realize what a cool design that our bones that our bones really have. Now, bone marrow, another thing you guys might know about bone marrow, some of you guys might have had to have a surgery, I don't know, and you might have had a bone graft or something, and that's a lot of times taken from the bone of the pelvis where the bone marrow is. And then I'm reading some questions. Sorry, they made me laugh. Thanks, guys. Yeah, we're going to get to some of those. And some of you guys out there, you might have even been sick where you had to have a bone marrow biopsy taken. And if you did, you know that can hurt. And man, we just want to tell you guys how brave you are for going through that and doing that, and give a big shout out to any of you guys who have had to have that done, because we know that's really tough, and we hope you're doing okay after that. So that's just kind of a little bit about what our bones do. They give us shape and help us move. They protect our organs, our heart and lungs, our brain, and the bone marrow of our bone actually makes cells that our body needs.
Makes the red blood cells, which carry oxygen around your body. It makes the white blood cells, like Dr. Savage mentioned earlier, which helps the body fight infections. And it also makes platelets, which are a type of cell. Like if you get a cut or a scrape and you form a scab, those platelets will go there. Well, when it starts to bleed, the platelets will go there and actually help form that scab to make the blood clot off.
Yeah. So cool. And man, we could probably talk about just this topic all day, but you guys probably don't want us to do that.
Probably not.
So I hope you learned something out there. But while we have it, hey Suzanne, what would do all animals have bones?
That is a good question. Some of y'all may have learned in your science classes that you have the different animals. You've got vertebrates and invertebrates. The vertebrates are the ones like us that actually have a backbone and a skeleton. We'll go over the spine a little bit later, but the bones of the spine are called vertebrae. And we do have some cool slides that we can't show. But animals that are considered invertebrates without a spine, like worms, mollusks, jellyfish, those that don't have the skeleton. Oh, there we go. Can y'all see that?
I don't know if you guys can see that or not. You probably can't. You're probably still just seeing us, I think. Yeah. Dr. Savage should have figured that out a little bit. That's okay. So, do what?
So I wonder if you would have minimized that. If it would...
Let us play with something real quick.
Maybe not.
Nah, I don't think so. That's okay. That's okay. We got we got a lot. We still got a lot of good stuff, I think. So, but yeah, like Miss Suzanne was saying. So, there are some animals that don't have bones or don't have backbones. Like, and it could be like if you were like a snail or if you were a worm. Think about it. They're really floppy and they don't have any bones that hold them up. Or other ones are a starfish. Mm-hmm. Pretty cool. When you might think about one that you might see, you might think of one you might see at the beach around here, like in the summertime, that you might not want to get close to because sometimes they can sting. I was just seeing if anybody would answer. No. Jellyfish. No bones in a jellyfish. You know who else doesn't have bones? And I really wanted to show you guys this video. You guys, a lot of you kids probably know this. Olaf. Yeah. Olaf, remember, he says he doesn't have a skull or bones. Yeah. Miss Suzanne doesn't think it's funny.
The video is funny. Funnier than Dr. Savage.
All right. So, so those are some animals that don't have bones. Well, if we didn't have bones, we couldn't even stand up and get around. So we're pretty happy that we have bones. So let's move on to talk about. I'll tell you what I'm gonna do. You guys are asking some good questions, so I'm gonna kind of get off of our topic a little bit here and kind of go back and try to answer some of these. So we had a 5-year-old girl named Ruby who wants to know what our favorite bones are and why. That is a good question, Ruby. What's your favorite bone?
Oh, that's a really good question.
This is hard for us. We kind of like all of them.
I know. I think the bones in the hands are pretty neat. We'll go over that a little bit later on. You know, your hand, you think about how much motion you have in your hand, and you actually have 27 bones in your hand and your wrist that all working together allows you to pinch and make a fist. But then the big bones are pretty cool too. You got the femur. Yeah. That's pretty cool.
Yeah, I kind of like the femur. The femur is the biggest bone. It's this big thigh bone right here. It's the biggest bone. I don't know. Maybe I like it just because it's the biggest. I don't know. Hey, you guys, what's the smallest bone? Does anybody know what the smallest bone is? Kind of seeing. I'm kind of going down to see if anybody's.
Hey, Haley.
Yeah. Hey guys. Does anybody know what the smallest bone is? The smallest bone in the body. I'm gonna give you guys a minute. Think about the smallest bone in the body. I want to see if anybody can type in some responses because we got 70 people on here watching. Somebody's got to know what the smallest bone in the body is. So while we're waiting on a couple of responses from that, I saw another question a minute ago, and I didn't get the name, but it was a really big question, and I think really important, that asked, why do we call it the funny bone? I'm going to let Miss Suzanne tackle this one because this is a very common misconception.
Let's see here. I can probably show you on Georgia here. So your people think your funny bone's in your elbow, and it kind of is, but it's not really a bone. So you have your humerus, which is the humerus. It's kind of funny, yeah. The humerus connects your shoulder to your elbow, and so some people say that's called the funny bone. But if you hit it and you get that sensation that goes down your hand, you're actually not hitting the bone. You're actually hitting a nerve called your ulnar nerve that goes right through here, right in this groove here at the end of the humerus, right here on your elbow. So if you hit it and you get that sensation, you're hitting your nerve. And so you'll say you're hitting your funny bone, but it's actually a nerve that runs right on the inside of that humerus.
So there we go.
Good question.
There we go. Big reveal. The funny bone is not actually a bone. How about that? That's one you can go back and tell your teachers at school about when you get back to school. That's going to be a good one. All right, so we've got some answers coming in. Let's go back and see. Remember, the question was, what's the smallest bone in the body? So we had the pinky. Now that's a good guess. I mean, you could think the pinky would be. It's actually not the pinky.
And there's actually 3 bones in the pinky.
Yeah, there are. That's actually 3 bones. I'll show you those too. So, yeah, we've got a right answer. I'm gonna come down and see. A toe, yeah, I mean, like your little toe, you would think that certainly could be, but believe it or not, it's not a toe. There's actually more than one bone even in your little toe. Somebody said the funny, we have Stuart who said it was the funny bone that's the smallest, and you know, if it was a bone, it could be. All right. Now you guys are getting onto it. James, it's not in the spine, sorry. Now you guys got it. You're talking about some bone. Yeah. So how about it? It's in the ear. Did you even know you had bones in your ear? Now, we are not going to be able to show you those on George because if George had them, they fell out a long time ago. George has been through some teaching before, so he's missing a few parts, but that's okay.
But yeah, it's a bone that's called your stapes. It's one of the 3 what's called ossicles. They're bones in your inner ear. We, like in orthopedics, we actually don't deal with that. We let the ENT, the ear doctors handle that. But yeah, it's called the stapes. It's T9C.
So good. So a lot of you guys have gotten that right. So that was really good work. Awesome. Okay. So hey, you guys keep giving us questions. I'm scrolling back through just to see if I missed anything big. Actually, this kind of leads us into our next part. We have a question in here about how many bones there are in the body. We'll talk about that, and then we'll talk about what they're made of.
Yeah. So the grown-ups, we have 206 bones in the body. 206. So that's a lot.
That's a lot of bones.
Now kids.
No, you're right.
Kids, you know, their bones are still growing, so they actually have about 300 bones, and that's just because the bones haven't fused together. And we'll talk about that in just a second.
More bones in a kid's body than a grown-up.
Well, they're smaller. They're smaller.
Oh, there's that. Okay.
And then they get longer and longer as they grow.
You know, whenever I explain this to people, I tell them, you know, we do talk about kids having more bones than grown-ups. It's not actually that they have bones that grown-ups don't have. Their bones are just kind of in more parts. So some of their bones are in 2 different parts, and they just haven't grown together yet. So it's really is like 2 different bones.
Some of the long bones, you know, in me, it's all one bone like the femur, but in a kid, it's actually 3 different parts.
Yeah, and
actually 4.
Man, I really wanted to show you guys an X-ray
of that
too. By the next time we do this, we're going to have that figured out.
And if not, we can at least try to post them to the page.
Right. Some of the pictures, things we're talking about, that's right. That's a good idea. We'll post them to the page a little later with some explanations. But yeah, like if kids, like you kids who are listening, if we show you an X-ray of like your knee, and then we show an X-ray of your mom and dad's knee, they'll look totally different. They almost look like they're not even from the same type of animal. And so that can be a really cool thing to kind of look at and see. So we'll post some pictures of that to the page too. Mrs. Ann's going to try to show you.
Can y'all see that one? It's not. It's kind of
That's a little hard.
All right.
Yeah, that's okay. We'll post some later. We're going to post you some pictures on the page that you can look at. That's a picture of a kid's bone right next to the picture of an adult bone, so you can see the difference in those. So that's how many.
The difference is what's called there's a growth plate in kids.
Yeah, and that kind of brings us to our next thing. So your bones have growth plates in them, and so the growth plate is why it looks like it's more than one bone, and so that's where your bone grows from. And so let's get so yeah. So like in you guys, so this is a hand and a wrist right here. So in you guys who are younger, way down at the end of your wrist, kind of down on this part down here, you would have a little gap in the bone, like the bone looked like it was separated. And that's because that's actually where your bone is growing from. It's not that it's broken, it's not that there's really a space there, but that space is filled with something we call cartilage. Now what's the difference between cartilage and bone? So cartilage is, I sprung that one on you there.
You did.
So cartilage is, so where bone is very hard, cartilage is soft. And bone shows up on x-ray because it is mineralized and calcified, and it has, ready for a cool word, guys, it has something in it called hydroxyapatite.
What is that?
Did I just get hungry? All right.
Oh,
all right. I'll keep the
Y'all see what I have to work
with but because the bone is mineralized with hydroxyapatite, you actually see it on x-ray. Cartilage doesn't have any calcification or mineralization, so you don't see it on x-ray. And that's why when we show you x-rays of a kid's bone, and this is for moms and dads and kids when you see these, that's why there's these little spaces between the bones, because that's where the bones are growing, and there's a cartilage layer there.
And if you ever see an x-ray of a baby, it's like
it almost looks like
the bones are like
bone.
this big. They're tiny because most of their bone is actually made up of cartilage and hasn't mineralized.
And that's how bones form, and that's how they grow. I had a question from somebody before we got on here today, asking about how bones are made. Well, bones are made even when we're being formed inside our moms, right? I mean, they're being made then, but most of the time, the way a lot of our bones are made is you ready for a big vocabulary word again, by something called enchondral bone formation. And so there's basically a cartilage scaffold to the bone that's made first. That's kind of like something that's made before the real bone is made. It's kind of in the same shape, and then that gets filled in with bones. So that even happens like before you're born. I mean, how that's just awesome, right? And then so after we're born, our bones keep growing, and the cartilage at our growth plates. I'm going to post a picture of this to the webpage too, because I want you guys to see how awesomely arranged all the layers of a growth plate are, and how perfectly they have to be arranged in order for the bone to grow the way that it's supposed to, and the way things just line up absolutely perfectly. So you have cartilage, and then these cartilage cells all line up, and then eventually, when you get further down the bone, the cartilage cells start to calcify and mineralize, and they become the bone that you feel in your arm and that you see on X-rays.
The growth plates are like little volcanoes. So instead of putting out like lava, they actually put out the bone, and over time, that as you grow, it stretches and gets longer and longer and becomes more and more mineralized, where you can actually see it on an X-ray. So.
All right, so we'll go from that into telling you a little about what your bones are made out of. Then we'll answer a few more questions, and then after that, we're going to do a little experiment, and that's how we're going to learn about actually the names of all the bones in the body. Because George here doesn't have all of his.
No, George is missing a few,
and
but
so
that's okay. Not everybody's born with.
But
with
we're going to find a way that we can show you every bone, and we've got some ideas. So all right, all right, so what are your bones made out of? That was a question that somebody had asked. I don't think on here, but somebody had sent in prior. So bones are made out of a few things. Does anybody know what your body's made out of? What everything in your body's made out of? Y'all answer that while I'm telling you what bones are made out of. You're talking about your skin, your organs, your muscles, kind of what the building blocks for everything in your body are. Let's see if you guys have some answers for that. But because those things are in bone, I'll tell you about those in a second. But bone is made up of some different substances. One is a protein called collagen. So another vocabulary word. They're giving you a lot of vocabulary words so far. I'm giving you hydroxyapatite.
Not everybody gets those.
Collagen. So collagen, and specifically collagen called type 1 collagen is what makes up, for the most part, the protein in bone. There's some other smaller ones that we could get into, but that's the main protein. And so the protein that makes up bone, you don't think of protein in making up bone because proteins are kind of soft, kind of flexible molecules, but the collagen in bone gives bone some of the flexibility. Your bones actually do have a little bit of flexibility, and they give your bone what we call tensile strength, so strength against bending and stretching. And then there's another substance that makes up bone, and that's the mineral part of bone, and it's this thing that I mentioned called hydroxyapatite, and it has calcium.
He really likes that word.
I love that word.
That so many times.
Favorite. And it's got calcium and phosphorus. And some hydrogen and oxygen, and I'm going to post a picture of that on there too. You guys are going to have to remind me all these things I'm going to post. I'm going to post a picture of that and actually show you kind of what the chemical formula for it is, because it's something that we all have to learn. So, so I'm going to make you guys learn it too. But the mineral part of the bone, the calcium, that's what gives bone that's what really gives bone its strength. It's compressive strength. It's strength against kind of, if you try to bend it or break it or compress it, that's what makes it stronger. Let's see if anybody answered what the kind of the building blocks of. James says water, not water, buddy, but what we're talking about does have a lot of water in them. He said minerals. There are minerals in bone, like we just said. Water. So there is a lot of water. Our bodies are mostly made up of water. But what I was thinking about cells. So everything in our body, our skin, our heart, our lungs, our muscle, everything's made of cells. Cells are kind of the building blocks of any living organism. And so there's some different types of cells in bone. One is called an osteoblast. A good word too. So osteoblasts, those are the ones that make bone. Osteoclasts, blasts and clasts. So osteoclasts, I think of that they clash with the bone. Now they're very important, but they actually help take away bone. Why would you need to do that? Well, our bones have to be reshaped while they're growing or when they're healing, and so that's why we have to have those types of cells. And then there's other cells called osteocytes and osteoprogenitor cells. These are all different types of cells that are in your bone that help to build and grow the bone and then reshape the bone based on the way that you use it.
You talked about kids and their bones growing, but even once you reach adulthood and your bones have stopped growing by the time you're around 20, early 20s, you still need those osteoblasts and osteoclasts to remodel the bone. In fact, our body over the course of about 7 to 10 years will the skeleton at least will completely replace all those cells with new ones. Not all at once, they happen over time, but about every 10 years you have cells that weren't there 10 years beforehand because those osteoclasts are breaking them down. The osteoblasts are forming new ones.
Now we're talking about how bone. So what we're talking about here too is, and I think this is really important, is that we're talking about your bone is alive.
It is.
Yeah, it is alive. I think sometimes, what do you think some people think about their bones as, like the framing of a house?
I think they just think of the skeleton here as just being a structure, like you said, the framing of the house. And you don't see it because all you see are the walls and paint and everything, but it's in there and it's alive.
Yeah, so and so all these things are going on, and and your bone is really doing a lot of different things, in your body. It's not just sitting there static. And, so that led me to a question about, our bones are alive and living. So somebody asked a question a minute ago about why, I think it was like, why is my mom always telling me to go outside or something? I saw that one come up. I think it might have been Tucker. I can't remember.
It's really, your like you said, your bones are alive, and we talk about remodeling and reshaping and getting stronger not only with eating certain foods high in minerals like milk and meat and all your veggies and fruits, but also staying active and going outside and playing and running and jumping. So that those bones get stronger and stronger, because the more you work them, the stronger they get. If you think about like the bottom of your feet, the skin is real tough because you're always walking on them, as opposed to the top of the feet. Your bones are the same way. The more you use them, the stronger they become.
Absolutely. So, man, getting outside and playing and running, and if you're a little older, working out and exercising, those are super important for healthy bones. What else is important for healthy bones? Nutrition. What you eat is super important. So look, and we just talked a minute ago, bones are made of calcium, sure, so milk is great, but bones are also made of protein, man, so you got to eat your meat, you got to eat those vegetables, those things that have those different types of nutrients in them. So your moms and dads are right. Sorry. And then I tell you the last thing, especially when you're growing, it's super important for your bones growing and everything in your body is sleep. If it's like my house, and bedtime can be a challenge sometimes, and nobody wants to go to sleep, man, sleep is super important. Really important for growing bones and for growing stronger. Those things really to help build strong bones. Your exercise, sleep, and eating kind of the good foods and the things that your mom and dads tell you to eat. And those things that have good protein and also the good calcium and minerals in them. So I think that's some good information.
Yeah. Hopefully y'all learn some good stuff.
I think one more thing, because before we do our experiment, because we're at 30 minutes, and I think so we need to do our experiment here. The last thing, because I had a question about how do I know how tall I'm going to get or something. Well, the short answer is we don't. There are some ways we can predict based on what your x-rays look like. There is a way in orthopedics we can predict by taking an x-ray of your hand. Sorry. I went the wrong way. Take an x-ray of your hand, and we can tell kind of basically how old you are from a bone standpoint. So there's different ways we can predict, but in general, I'll give you guys a rule of thumb. If you're a girl, most of the time you're going to keep growing until you're about 14 years old. That's just kind of rule of thumb. And then for boys, we tell you you're going to keep growing until you're about 16. And we all know people who grow
these
for
are relative. Some people may stop 2 years beforehand. Some people may go 2 or 3 years beyond that. But these are just average numbers.
Yeah.
So if you're 14 and you're not very tall, you might still grow. That's fine.
Yeah. Yeah, like I say, I mean, a lot of times people want us to predict that when you come in and see us, and it's really hard. I mean, we can't. I mean, I have a brother, and he grew after we went to college. So, I mean, you can get taller, a lot later on. Okay. All right. So, look, I hope you guys have learned a few things about just kind of bones so far. We want to go through and teach you kind of the names of the bones real quick here. And we're going to actually do an interesting experiment. Miss Suzanne is going to step out and get ready for your experiment. Yep. Is that right? Yep. And we're going to have an assistant come in just a second to help us with this too. So if you guys hang on, we're not going anywhere. This will be kind of the last thing we do. And then while they're doing that, I'm going to look through and try to answer a few questions here. Why do we get arthritis? So that's a good question. And I know one we haven't touched on because we were kind of talking just about bones today. We'll probably do. Look, if you guys like this, I plan to do a few more of these and kind of talk about other conditions too. We might address arthritis in another talk. Arthritis is when you start losing cartilage cells on the end of the bone at the joints. And there's a lot of different reasons that can happen. Oh my gosh, Miss Suzanne, a lab coat. I think this experiment is getting real.
We're getting official here.
Okay. We had a Michael who asked, how do your fingers move up and down? Okay, good. I think we're about to answer that one for you. How's your knee able to bend? Stuart asked, how's your knee and leg able to bend? I think that leads very well into this right here. Okay. Okay, Stuart, Michael. All right, awesome. So Julia, can you come into the room for us? So, all right, this is Julia. This is my daughter, Julia. We didn't just find somebody to come do this. So Julia has volunteered to do an experiment with us today. We need to be able to help people name all the bones in the body. Since George over there didn't have all his bones, we have a way that we think we're going to use your bones to do this. Okay.
Now I did test this out last night.
They can't see.
Okay. All right, here we are. All right. So we have we're very technical here. We have a bone sucker outer thingy.
Let's get it closer and show them.
So what do you think would happen if we didn't have our bones?
What do you think would happen if Julia had no bones?
We are going to find out.
Yeah.
So hop up here.
Lucky for you guys, Suzanne and I downloaded an app last night.
This is Bluetooth,
that lets us do
Bluetooth
that.
ready.
So ready. Okay.
So
all right.
he's gonna turn this on. We're gonna
ready?
Suck the bones out.
So I'm hitting remove. Julia, are you ready?
So
now look, we're not doing anything to your skull, so you'll still be able to talk.
Yeah. Oh yeah. Okay. So make sure leave skull, and we're going to leave the ribs, okay? Because remember, like we talked about earlier, those help protect all the important organs in our brain. So we're going to leave that. We're just going to go over the.
We'll still help you guys learn the other bones. All right, ready? Ready? And 3, 2, 1, go.
Whoa.
Julia.
Hold up here. We got some bones in here.
Julia.
Let's dump it all out here.
So since we did a little bone-ectomy here, can you move your arms? No? Can you move your legs?
No.
Do you want them back?
All right, so I'm going to pick it up and just.
Okay, all right.
Geez.
So so if we didn't have any bones, we would just be kind of like a blob.
Still
Right?
have the skin and everything, but she can't do anything. She can't move.
So did you need bones for
We
us?
did. We got all kinds of bones here.
Can we demonstrate on your bones real quick? Okay, awesome.
So we're going to start with, let's see what we have in here.
All right, I'm gonna let Suzanne kind of. We're gonna name all the bones for you.
This is part of the arm bone. Okay, we talked about this a little bit earlier, but this is the humerus. Okay, can y'all see that at all?
Yeah.
The humerus goes from your shoulder all the way down to your elbow. Oh, can you see that? Okay, so it's a long bone. You'll see that it's a little bit wider at the top and at the bottom, just to give it more strength. And it's narrower in the middle here. But the top is the shoulder. It's the ball of the humerus, ball of the shoulder. We'll go over that in a little bit. And then down here's your humerus. You got these bony structures here. If you look at your elbow, if you feel your elbow, there we go. You feel this is harder. Okay. You feel your elbow, you got these bony prominences on this side and then on this side. And that's the end of the humerus there.
Yeah.
Then from your elbow to your wrist, you actually have 2 bones. You have your radius. Yeah, this is right. So you have your radius, which is a little bit bigger and goes all the way down to your wrist, and then ulna, which is a little bit smaller. The ulna, if you look back here, your ulna comes up and attaches to the humerus. Well, it doesn't attach to the humerus, but it's connected to the humerus. And you get by this little thing right here, that piece of the bone, it's called your olecranon.
That's olecranon. It's another vocabulary word.
That bony piece on the back of your elbow. Your radius up here, if you feel just below your elbow and you turn your wrist like this, palm up, palm down, you can feel that radius moving back and forth. Okay, so that's pretty cool.
So let's go through this again. So we had the humerus, the long bone in your arm. We had the radius and the ulna. So those are kind of the bones in the arm. And then here, let's come back to that. Yeah.
Yeah. So then we get to the wrist and the hand. You know, there are 8 bones in your wrist. And in your wrist and your hand, you have a total of 27 bones. So you have all these bones, these 8 bones in your wrist that you think about just how much your wrist moves. You can wave, you can bend this way, you can roll it. But these bones right here, these 8 bones are called your carpal bones. And then in your hand here, you have 5 metacarpal bones. Can you see that? Yeah, there you go. And then you have your thumb and your fingers. Your thumb only has 2 bones in there. Those are called your phalanges. And then
vocabulary word.
Yeah. See, this is why medicine's so cool. And then in your fingers, you each have 3 phalanges. Okay, so you have your carpal bones, your 5 metacarpal bones in your hand, and then your fingers all have phalanges. Isn't that a cool word? So all of that together is your arm bone.
Yeah. And so I think there was a question about how things move a minute ago. So your bones are connected together, right? So there we go. I got it right there. So at the elbow here, the elbow works kind of like a hinge joint, right? And so if all these bones here where these colors are on them, the reason those are there is those are muscle attachments, some muscle and tendon attachments and things. So your muscles, tendons, ligaments attach at different areas, and that's what keeps your joints together, and that's what lets your elbow move like this. Now your shoulder, we actually don't have this one put together, but your shoulder works kind of like a ball and a socket joint. And that's why in your shoulder, you can roll your shoulder all the way around, but in your elbow, generally just moves more kind of like a hinge. Yeah, there you go.
This and the shoulder, the arm bone, that humerus we talked about earlier, actually attaches to your body via your scapula, which is a funny looking bone. It's a triangular bone that has all different, different parts of it, different sides of it have different purposes. But on the glenoid part of the scapula is where that ball and socket is. Yeah, we'll get to it. You're about to get some arms. So that's what he's saying, a ball and socket joint. Because if you think about your shoulder, you can move it pretty good, as opposed to your elbow. You can only move it this way or this way, but it's a hinge like that, just like you think about a door opening and closing. You can only open and close, whereas the shoulder with the ball and socket moves pretty good.
Cool. Very good. Let's go. Let's give Julia some arms back.
Yeah, let's do that.
All right.
Okay.
So we better test this out because we got to make sure we can get her all back together. So
put it in here.
All right.
Put the arms in here. Okay. So we're gonna put the arms back in.
All right.
Ready?
Ready? 1, 2, 3. What you got?
Wow, look at that.
Oh, all right. So we got some. So when we have bones, just like we just showed you with the joints, like what can your shoulder do now? The ball and socket joint can move. Show us the hinge joint at the elbow. And the fingers are kind of hinges too. They're a little bit different, but so show us how they can move too. Great. Okay, good. All right, great, good. All right, it's working.
It is.
This is amazing.
I know.
Hey, this is just a free app.
You have to go to medical school to get that.
All right.
All right. So let's so we got arms. How about some legs?
You want your legs back?
Legs now?
Yeah, you're gonna have to be able to jump on the trampoline again and stuff. So you probably want some legs back. All right. Okay. All right. Good. Okay.
All right. So that's a leg. Okay. Your leg goes from your hip all the way down to your feet. So the hip. The hip here. So this is your femur. Okay, femur connects from your hip all the way down to your knee. We talked about the shoulder being a ball and socket joint. Your hip's also a ball and socket joint. This is the ball of the hip. We call that the femoral head. Okay, and then this is the long shaft of the femur here that goes down to your knee. Okay. This little bone right here is called your kneecap, or the fancy word for that is patella.
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 Yeah. You guys can tell everybody that you're kneeling down on your patella. They don't think you're really super smart.
It's there to kind of help protect the knee joint. When you bend and kneel, it's there to just protect everything. Then you have in the lower leg, from your knee down to your ankle, you have 2 bones. Just like in your arm, from your elbow to your wrist, you have 2 bones. In the lower leg, you also have 2 bones. You have this big bone called the tibia. That's a big bone. That's also so you might know that as your shin bone on the front of your leg. That's your tibia. And then you have this smaller bone called the fibula. So you have tibia and fibula. Okay. Now this
very important.
The tibia is what really supports your lower leg. It's the main weight bearing bone of the lower leg. The fibula has a lot of muscular attachments, and it'll provide some stability down at the ankle here. The ends of these bones, you may be able to see it. You got these little pointy pieces. These are called your medial and lateral malleoli. If you feel your ankle, you got a little bony prominence on both the inside and the outside of your ankle. That's on the inside. That's the end piece of your tibia. Okay, and on the outside, that's the end piece of your fibula.
Hey, any of you guys, if you've ever broken like a bone in your ankle, you probably broke one of these parts of the bone right here, because that's something we really commonly see. And then, man, it looks like we're going down to the foot. It looks like we have all kinds of bones in the foot.
There are all kinds of bones in the foot. The foot has 26 bones. Okay, 26 bones. This heel bone right here. The fancy word for that is called your calcaneus. Say that, calcaneus.
Not one of my favorite bones.
Yeah, that was tough. That was tough. It's a weird shape. There's lots of different. It's just a weird bone.
It is a funny shaped bone. I totally agree.
Yeah. The underneath the ankle, though, between the calcaneus and ankle, is called your talus. It's called your talus. So when you move your ankle back and forth, there's actually a lot of ligaments. We talked about how bones are attached, and ligaments, which are like tight rubber bands that connect bones. Ligaments at the ankle, if you've ever twisted or sprained your ankle, there's some ligaments in here that typically get get injured both on the inside here and the outside. So that's why you may have to wear, like basketball, volleyball players may have to wear a some kind of support to protect those ligaments, because there's a lot of important structures in here it's got to protect. So back to the foot, we got the calcaneus, we got the talus down here at the bottom, and then these bones right here. Can y'all see that at all? All right,
Look at all these little bones.
you have several bones here called your tarsal bones, and then metatarsals here. Well, no, I'm missing
we
one.
lost part of one.
These are called your metatarsals, which are the longer bones in the foot. And then each one of your toes has phalanges. Now, we talked about in the hand, you have your thumb and your fingers. Your thumb has 2 phalanges, and the rest of your fingers have 3. Your toes are kind of the same way. The big toe, or great toe, what we call it sometimes is called your hallux. Okay, that's only got 2 phalanges, and then the rest of the toes have 3. So let's go back here. We have starting at the hip. We have your femur, goes from the hip down to your knee, with your kneecap on the front, or your patella, and then down to your tibia, which is the big shin bone, your fibula, which is the smaller bone on the side, talus, calcaneus, heel bone, the tarsal bones.
And those all have names. We'll let you guys kind of look those up, because there's a bunch of them.
The metatarsals, the long bones in the foot, and then your toes have phalanges. Pretty cool, huh?
That's pretty awesome. Jody, you ready to get your legs back? Thank you for letting us do that. We just learned all the bones in the arm and in the legs. So, okay. So, all right. Ready? We're going to
here we go.
replace some leg bones. 1, 2, 3, go.
All right.
Can you move those legs?
Yay!
But can you sit up yet? What if you try really hard?
Okay. You know why that is?
Why can she's got arms and she's got legs? We put those back. Why can she not sit up?
So, interestingly enough, there's actually, the skeleton has 2 parts. Okay. What we put back in Julia now is what's called, here we go, another big word, appendicular skeleton.
Appendicular
Can y'all say that? Appendicular. Okay. That's your arms and legs. That's what allows, movement of all that. But what allows you to stand up straight or sit up are the bones in your spine, called your axial skeleton, which includes your skull, your spine, and down to your pelvis. Okay. So without that, she can't sit up. So let's see what we have here.
I don't know if axial skeleton's on the app.
Well, we do have a little something here. Okay, so here we go.
Perfect.
Here we go. So this is your spine. This is actually the bottom of the spine here. This is called your lumbar spine. Let's bring George to the top of George in here. Okay. So, yep. So we'll actually start. Let's see. Can y'all see? Can you see the skull at all? Yeah. So we have the skull here. Okay. And the skull is actually, as a baby, it's actually multiple bones that actually fuse together to form the skull. We're not going to go over all of that, but just know that it's one solid structure by the time you're a grown up.
Yeah.
So, but it's also got this bottom piece here called your mandible. That's the jaw. Okay, the bottom part of the jaw. It's the only part of the skull that moves. Okay, so that's your mandible.
Just a sec. Just to confirm, you'd like to call Grim?
Siri.
Sorry about that.
My phone thinks I'm talking to Siri. So skull, mandible. But then these are all your rib cages. Now we didn't talk about this earlier, but you have 12 ribs on each side. Okay, and you can see your ribs go all the way around from the back of your spine here, all the way around and attached to your sternum, which is this is a very strong bone. It's thin, but it's very strong.
Remember we talked about the sternum being a flat bone where there's a lot of red marrow where some of the blood cells are made.
Yeah, so the bones are all attached, the ribs are all attached to the sternum, except for the bottom ones. The first several are attached with a bone, then you get in, they're attached with cartilage, but the bottom 2 are actually what we call floating ribs. They actually don't attach to the sternum. Now, no need to worry, they still attach to the spine back here, but these bottom 2 are what we call floating ribs. Okay?
Yeah.
So back to the spine though. Let's get
your spine marked.
Yeah. So
thanks, George.
Yep. So the spine has these little building blocks here called vertebrae. Can you see that? Okay. That's what they're called, the vertebrae. Okay. We're almost there, Jude. So these are called your vertebrae. You actually have, starting up at the top of your skull, you actually have 7 cervical vertebrae, and then you go into 12 thoracic vertebrae, and then you go into 5 lumbar vertebrae. Okay, and then you go into the sacrum, which is, it's actually multiple vertebrae that are fused together, that are kind of in your bottom region.
So this, like some people might call like the tailbone, it's actually several bones that fuse together. So that's the very bottom part of the spine. Yep.
And in between, you'll see these little, what these are called discs. These are like little cushion pads in between the vertebrae, that just help provide some shock absorbing qualities to the spine. So, and then it also, behind the vertebrae is actually your spinal cord. So one of the jobs of the spine is to protect the spinal cord that has all the nerves that go from your brain out to the rest of the body. That's good.
And just so like we learned about at the beginning, the skull protects the brain, the ribcage protect the heart and lungs, the bones of the spine protect the spinal cord. And your spinal cord is super important because the nerves in the spinal cord are what let you move your legs and move your arms. So we have to have all those things together. So if we put Julia's, all right, we have her appendicular skeleton. Remember, appendicular. Now we're going to put her axial skeleton back in. And when we do this, she should be able to get up and move just like normal. So are we ready?
If it works right.
All right.
Which it did last
night. So if
it
works right. It worked good last night.
Yep.
Yeah.
Yep.
So,
all right.
You ready?
Ready?
1, 2, 3.
All right.
And get up.
Yay!
Can you jump? You can jump? All right. Can you put your arms above your head? Awesome. So, very cool. So, without bones, remember that our bones are what give us our shape. Our bones are what let us be able to move. And I hope you guys have learned a lot about bones today. I want to I'm going to look back through some questions here for a few minutes. Try to answer a few more for you guys who are still staying on. And what I really like too is this is our first try at this, and I appreciate you guys kind of tuning in and joining us. If there's things that you would like us to teach about, just come on here and talk about and give some share some of our knowledge on, please comment and tell us and let us know. We've got some comments about arthritis and muscles and different things, and since you said hey Joey. And those things are all good and definitely all topics that we could spend some time talking about. But it will be a whole different conversation to discuss. And then look, tell us ways you think we can make it better. If you guys look, if there's things about using Facebook Live that you think we need to know, this was literally our first time ever doing this. So I'm sure it probably shows, but we've had a lot of fun doing it. I know I have.
Yeah, it's been great.
Yeah. Yeah, I think what we may do, we had a little. We're getting close to an hour here. I know that's a long time. I see kind of our numbers starting to go down because people are starting to sign off, and that's good. I think we were going to talk about broken to the end, but I think what we might do, I think we might leave that for like another talk next week, because for broken bones, I wanted to talk to you guys about how bones break, and then how they heal, what we do as bone doctors to help them heal, like put them in casts or sometimes having to do surgery. What I really want to do before I do that too is I'm going to get better at figuring out how to show you guys some diagrams and videos, because we have some cool ones. But some of the things from today, remember, we're going to post some things from today to the website. Some of these things we've talked about, especially about the different types of cells in bone and the growth plates, and some X-rays showing what kids' bones versus adult bones look like. I'm going to post some pictures to the website showing you guys some of that. And then if there's anything else you guys kind of want me to post afterwards, again, just comment and let me know. Or if your parents just know me and my wife, then just text it to us, and we'll be happy to get it on here for you guys. Let's scroll back up through real quick before we stop and just see if we had any other questions. Oh, hey, Elizabeth. Oh, Michael broke his. Okay.
Yeah.
Okay. All right. Micah, we're sorry you're dealing with a broken arm out there, buddy.
Hope you're feeling better now.
Hope you're feeling better. Let's see. All right. Now that's an interesting question here. But it might be for another topic too. Elliot asked, "What happens if your bone dies?"
Ooh, that is a whole other topic.
That is a whole other topic there. That is actually something that we deal with in orthopedics. That usually does not happen in kids, but there are some times when you can have some problems where bones. So one thing we didn't talk about bones and just that the fact that they're living is that they have to have blood supply to them. And I didn't talk about that because it starts getting a little technical about how bones get their blood supply. But we certainly could go into that. So there could be some times when if the bone doesn't get enough blood that it needs, where actually you could get some part of the bone that dies, and a lot of time when that happens, that's when you do need a bone doctor like us, because a lot of times we have to do a surgery to help with that problem. But very good to know that there are some very good surgeries that we do that really help people with that, and that's something that we do together, when we have to. So let's keep going back up. Julia, do you have any questions that you want to add in here? Are you looking through these as we do? Okay. That's some good answers to our questions. Or a lot of you guys got the answers right about the stapes. The cells one kind of confused you guys, but I think we finally got there. The bones are made of cells, and they're made of protein, and they're made of calcium, and the hydroxyapatite that we talked about. That's another thing I'm going to post. I'm going to post you guys a picture.
He's really just going to see how many times he can say.
We'll just see how many times I can say hydroxyapatite fast. Let's see. Can you break your growth plate? That's a pretty good question. What about that one?
You can break the growth plate.
Yeah, you absolutely can. So believe it or not, and I'll probably talk about this, and maybe the next time we do this, whether it's next week or when we talk about fractures. But you can break the growth plate. Kids get broken bones that are totally different than adult breaks a lot of the time, right?
Right.
Yeah. So when we talk about one that's like a green stick.
Yeah, and we might have some. We'll see if we can't get this.
Yeah.
We do have some pretty good videos.
So you can break a growth plate. The growth plates are actually kind of soft, and they're actually a little more prone to breaks. So that's a very good question. I think we're gonna. Yeah, I agree. I think we'll answer that one different in a different session. I just. Thanks, Robbie.
This isn't acting, Robbie. This is real life.
Okay. All right. Let me go back down to the bottom. I think that's probably about as far up as I can scroll. After a while, you can't scroll up anymore. I didn't know that. All right. Not a medical question, but Corey, that's funny.
Business attire.
Business attire. These are our business clothes. Okay. All right. It looks like we're kind of winding down on questions. So Suzanne, you got anything else that you want to close with?
We're good. I just thanks for tuning in, guys. Hopefully y'all.
Yeah. Thank you so much. This was fun. Thank you so much for your questions. I mean, the questions are really the coolest part of this. I mean, we can sit here and tell you things about bones. I mean, we like to think that we have a lot of knowledge that we've gained over the years. You know, Suzanne's been doing this for what, 15 years?
15 years.
Yeah. I mean, you know, I went to school for a long time for this, and I've been doing it for about 7 years. So she's been doing it for longer than I have. You know, and so. We really love kind of coming on here and kind of sharing what we know about things. And it's really cool to see what you guys want to know, because it gives me kind of some insight into what you guys are thinking. I think even when I see you guys as patients
y'all
now.
Y'all have really good questions.
You really
that
did.
Says it. I mean, y'all really thinking.
Yeah. Yeah, you guys.
Y'all know a lot already.
Like some of your questions, like I'm not even going to answer right now because they're so big. I feel like I need another time.
Yeah.
Like I need another 20 minutes or so to answer them the right way. All right. Well, we're gonna we're almost an hour, so we're gonna go ahead and sign off here. Hey guys, again, thanks. Hey everybody, all you guys who are at home. You know, I know it can be kind of tough. You know, these times when we're being out of school and we're having to be at home all the time, and we're not really able to go anywhere. I mean, I have Julia here with me, but literally all she did was leave the house and come right here. And we all had to get our temperature checked before we came in here and everything. So being very safe, and it's an important time for us to stay at home. And I know it can be tough, and kids, and parents just know. I mean, we're all in the same boat. And what I tell my kids all the time that they get tired of hearing about is, we know that we can't necessarily change the circumstances that we're in, but one thing we can always do is we can always change or be responsible for the way that we respond to them. And so that's why we wanted to do this today. We wanted to say, hey, look, how can we do something good and helpful in a time when things are
Try to keep it positive.
things are tough, and do something that that's positive and hopefully educational too at the same time. And while I love your questions about bones, I think my hope and my prayer for this would be if some of you guys are watching this, even if you're parents, that it maybe gave you some ideas about things that you could go do that are, because you're probably a lot better at this than we are. Technology kind of makes me sometimes, but I think this for a first time, we'll take it. All right. You got anything left, Julia?
No.
Okay. All right. She's at a loss for words. So, all right. Signing off, guys. See you next time.
Thanks, guys.
Bye-bye.